You are going to pass your ER nurse interview if you watch this video and use my guide, guaranteed. ER nurse interview question number 1 is tell me about yourself. Thank you for giving me the opportunity to interview for this ER nurse position with your hospital. Before applying, I carefully reviewed the job description and am confident I have the skills, experience and qualities needed to excel in this fast-paced role. I am also a compassionate and highly adaptable nurse with a strong ability to prioritise under pressure, communicate effectively and provide life-saving care in critical situations. In my previous role, I worked closely with multidisciplinary teams, ensuring patients received immediate, high-quality emergency treatment. I also helped mentor new nurses, guiding them through high-acuity situations to develop their confidence and clinical skills. I always treat patients, their families and my colleagues with dignity and respect while upholding the values of the hospital I represent. If you hire me, I will embrace ongoing training, follow best practices and provide exceptional emergency care to every patient I treat. Hello and welcome. That was a top scoring answer to introduce yourself in an ER nurse or an A&E nurse interview. Now, let's move on to the next essential question you need to prepare for, which is question number 2. Why do you want to be an ER or an A&E nurse? Now, this question is being asked because hospitals want to ensure that you understand the demands and challenges of emergency nursing. They seek candidates who are resilient, thrive in high-pressure settings, and are passionate about providing rapid, life-saving care. Therefore, in your answer, make sure you do these things. Number 1, demonstrate your passion for emergency medicine, ability to work under pressure, and commitment to patient-centered care. And also make sure you provide a real-life example of how you excel in critical, fast-paced situations. So here is a fantastic top-scoring answer doing just that. Why do you want to be an ER nurse? I want to be an emergency response nurse because I thrive in fast-paced, high-pressure environments where I can make a real difference in critical moments. The ER is unpredictable, requiring nurses to think quickly, act decisively and provide life-saving care, qualities I have developed and excelling. I am passionate about emergency medicine because it allows me to use my clinical skills, adaptability and problem-solving abilities to stabilise patients and support their recovery. In my previous role, I worked alongside multidisciplinary teams, ensuring patients received swift, high-quality treatment, and I found immense fulfillment in being a calm, reassuring presence for both patients and their families during distressing times. Being an emergency response nurse is not just a job, it's a calling. If I am successful in this role, I will bring dedication, resilience, and a strong patient-first approach to ensure the highest standard of emergency care. Again, this is another brilliant answer. Hello, I'm Joshua Brown from howtobecome.com, a leading interview training company that has helped millions of candidates worldwide prepare to pass their job interviews. And in this video, I'm going to help you succeed in your emergency response nurse interview or A&E nurse interview. Oh, and don't forget to let me know which hospital or organisation you're applying for so I can get back to you with extra interview tips and questions. Let's move on to question number 3. Tell me about a time when you dealt with an upset or angry patient. What did they say or do and how did you react? Now, this question is being asked because ER nurses often deal with distressed or aggressive patients, unfortunately. The interviewer wants to assess your communication, de-escalation and problem-solving skills while ensuring you remain professional and empathetic. Therefore, in your answer, make sure you show how you remained calm, listened actively, and de-escalated the situation professionally while maintaining patient dignity and safety. Here is a fantastic top-scoring answer to help you, but just before I give it to you, here's a bonus tip to help you. A brilliant way to structure your answer to any kind of behavioural interview question. A question where you're required to draw on your past experiences, just like this one, is to use the STAR method, STARR. And the STAR method is a way to structure your answer. So you do it just like this. S is for situation. You start off by describing what was the situation you found yourself in. T is for task. You then move on to describe what was the task that needed to be carried out. A is for action. What action did you take to achieve the task? The first R is for result. What was the end result following your actions? Make sure it's always a positive end result. And the final R is for reflection. What did you learn from this experience? So here is a fantastic top scoring answer using that star structure to the question, tell me about a time when you dealt with an upset or angry patient. What did they say or do, and how did you react? While working in the emergency department, a patient arrived in severe pain and became angry and frustrated due to the waiting time. They raised their voice, demanding immediate treatment and accusing staff of ignoring them. My priority was to de-escalate the situation, ensure the patient felt heard, and manage their expectations professionally while maintaining a calm, controlled environment for staff and other patients. I remained calm, actively listened, and acknowledged their frustration without interrupting. I explained the triage process and reassured them that they were a priority based on clinical urgency. I also provided pain relief within my scope and regularly updated them on their wait time. The patient calmed down, expressed gratitude for the explanation, and waited more patiently. By communicating effectively and showing empathy, I was able to prevent escalation while maintaining professional integrity. This experience reinforced the importance of active listening, patient reassurance, and staying professional under pressure, skills I will bring to this role. Now, don't go anywhere, as I still have more ER nurse interview questions and brilliant top scoring answers to give you, but when you're ready, and only if you want to, you can click that link in the top right hand corner or in the pinned comment below the video at any point during this training. It will take you through to my website, howtobecome.com, where you can download my top 30 ER nurse interview questions and answers to give you the edge in your interview. Okay, let's move on to question number 4. Why do you want to work at this hospital? Now, this question is being asked because hospitals want to ensure you are genuinely interested in their organisation, that you understand their values, that's very important, and their clinical focus, and that you can contribute positively to their emergency care team. Therefore, in your answer, research the hospital's mission, values, and the ER and A&E department's reputation, and mention what attracts you to their approach to emergency care, training opportunities, and patient-centered culture. Here's a fantastic way to do just that using this brilliant top scoring answer I've put together to help you. Why do you want to work at this hospital? I want to work at your hospital because of its reputation for excellence in emergency medicine and its commitment to delivering high-quality, patient-centered care. Before applying, I researched the hospital's values, clinical standards, and approach to emergency care, and I strongly align with its mission to provide rapid, compassionate, and innovative treatment to patients in critical need. I thrive in fast-paced, high-pressure environments, and I am eager to contribute my ER nursing skills to a team that is dedicated to excellence in trauma care and acute medicine. I am particularly drawn to the hospital's focus on continuous learning and professional development, which would allow me to enhance my clinical expertise while delivering the best possible care to patients. If I am successful in this role, I will bring strong teamwork, resilience, and a proactive approach to emergency care, ensuring I contribute positively to the hospital's outstanding reputation. Now, what I have done to help you pass your ER nurse interview is compile a list of the most common questions you must prepare strong answers to, such as, how do you handle high-stress situations in the ER? How do you prioritize patient care in a busy ER setting? How do you handle a situation where there are multiple critical patients arriving at once? How do you ensure patient safety in a fast-paced ER? How do you handle shift handovers in the ER to ensure continuity of care? What steps do you take to ensure accurate and thorough documentation in the ER? How do you stay up to date with the latest advancements in emergency nursing? How do you handle emotional stress in the ER? Tell me about a time you had to advocate for a patient in the ER? Where do you see yourself in 5 years? What is your biggest weakness? So those are just some of the key questions that you should be preparing for. But if you want the full list of the top 30 ER nurse interview questions plus brilliant example answers to help you pass at your first attempt, click the link in the top right hand corner or on the pinned comment below for 2 reasons. Firstly, this will take you through to my website, howtobecome.com, where you'll get all the answers we've covered today, plus a total of 30 expertly crafted responses to the most commonly asked ER nurse interview questions. Secondly, and as a bonus, I've also included 3 smart questions you should ask at the end of your interview on that page to make a lasting impression. It's a powerful resource designed to put you ahead of the competition, so make sure you check it out. I hope you've enjoyed this tutorial. Please subscribe if you haven't already. I'm on a mission to help as many people as possible pass their job interviews, and I can only do that if you are subscribed. Also, hit that like button if you found this useful. It really helps motivate me to create more content just like this for you. If you have any questions about this role or any particular nursing role or hospital, drop them in the comments below. I reply to all comments with tips and advice. And finally, connect with me on LinkedIn. The link is in the description. I'd love to connect with like-minded professionals such as yourself. Thank you so much for watching. I wish you all the best in your interview. Have a brilliant day.